Today in this video, I'm going to talk about Angelman syndrome. Angelman syndrome is a complex genetic disorder which primarily affects the nervous system, and there are 4 genetic mechanisms which are known to cause this Angelman syndrome. Most cases of Angelman syndrome are not inherited, and these genetic changes occur as random events during the formation of reproductive cells. Affected people usually have no history of the disorder in their family. Most cases, around 70%, occurs when there is a segment of the maternal chromosome 15 containing the gene is deleted. And in small percentage of cases, the cause is due to paternal uniparental disomy, when normally people will inherit one copy from each parent, one copy of the chromosome 15. But then in this small percentage of cases, Angelman syndrome results when the person inherits both copies of chromosome 15 from his or her father, instead of one copy from each parent. So this phenomenon is called as paternal uniparental disomy. And other mechanisms include imprinting defects and mutations in the UBE3A gene. Many of the characteristic features of Angelman syndrome result from the loss of function of the UBE3A gene. The characteristic facies of Angelman syndrome include flat occiput, occipital groove, and strabismus, which means squinting of the eyes. They may also have protruding tongue, tongue thrusting, swallowing disorder, and frequent drooling, causing feeding problems, and also truncal hypotonia during infancy. For clinical features, affected individuals typically present with delayed development usually by 6 to 12 months later compared to normal children development. They have severe speech impairment, ataxia, which is problems with their movement and balance, behavioral uniqueness, where somehow they always look happy and their personality is like always excited. Others may present with intellectual disability, epilepsy, and microcephaly. So this picture over here shows microcephaly, where there is decreased size of the cranium accompanied by marked posterior sloping of the forehead. I've highlighted a few features over here in red color. So these features are those that will persist throughout their whole life. Other features include constipation, fascination with water, hypopigmented skin, light hair and eye color as seen in this picture over here, abnormal sleep-wake cycles and diminished need for sleep, and also scoliosis, where there is lateral curvature of the spine. For investigations, we can do baseline brain MRI or EEG if there is seizure to rule out focal neurological deficits. We can do musculoskeletal exam to look for scoliosis, gait impairment, and muscular hypotonia. If there are these features, we should refer the individual to orthopedic team. We do ophthalmology exam to assess for strabismus, visual acuity, and if there is any evidence of ocular albinism. Developmental evaluation to see whether speech therapy and physiotherapy is needed, and dietary evaluation to evaluate for GERD in infants and young children, and to ensure optimal nutritional state for them. For management, we can give anti-epileptic drugs if there is seizure, can give sedatives if they have problems in sleeping at night, and also if they have scoliosis, we can manage by using thoracolumbar jackets or doing scoliosis surgery. That's all for my video. Thank you.